Hi, I'm Lydia. I'm a breastfeeding counsellor and mum of one, and I support mums from pregnancy through to postpartum, so either helping to prepare to breast or bottle feed or supporting postnatally, either getting things off to a good start or if things have gone off track, helping to get things back on. So yes, there are lots of things you can do to prepare to breastfeed during pregnancy, and the first is to create a feeding plan. Now this can be as part of or alongside your birth plan, but I always say that feeding and birth is intertwined, as once your baby arrives, they're going to need to feed. So it's a really lovely chance to reflect, have a think about what it is that you want. How would you like to feed your baby? Whether you'd like to breastfeed, whether you'd like to combination feed, whether you'd like to formula feed. It is your choice, but preparation can really help you to understand how to get there and how to successfully feed your baby how you would like to. Another really great aspect of a feeding plan is that you can prepare your support and just have a think about what is available to you in your local community, your area, or your local hospital. And preparing during pregnancy means that you already know where the support is before you need it, because it can be a really stressful time at the point that you need it. So preparing in advance can really help to manage that stress. My last tip would be to harvest colostrum. So if you have a low-risk pregnancy, from 36 weeks, you can harvest your colostrum. So colostrum is the first milk that your breasts produce around week 16 to 20, and then transitions to mature milk around days 2 to 4 following birth. So the reason you might want to harvest your colostrum is because if breastfeeding is delayed for any reason after birth, your baby's feed is ready and waiting for them. Think of it as an insurance policy or a backup. And it can just alleviate that stress and pressure to feed baby if there's something going on that means that breastfeeding is delayed. So there's really only two vital pieces of equipment you need to start breastfeeding, and that's your breasts and your baby. However, depending on preference, you may want to include a pump, especially if you'd like to bottle feed alongside breastfeeding. And also, if you need to remove milk to avoid getting uncomfortable engorgement and your baby's not nearby you, maybe you're away, then you will need to remove milk. So that can be either via hand expressing or a pump, and whichever method you choose really is down to preference. A few extra helpful things you may want to consider are things like breast pads if you find you're leaking quite a lot, especially in the early weeks as your supply settles. Also some comfortable pillows to make sure you have a nice seating area at home where you can feed your baby. And also some breastfeeding friendly clothes so that you can feed or pump with ease. And Seraphine offer a range of nursing bras and breastfeeding friendly clothes to help you to feed your baby or express comfortably. In order to feel more confident, I really recommend attending an antenatal feeding class. Now, I appreciate some antenatal classes will touch on feeding, but to attend something that is solely focused on feeding gives you an opportunity to learn about all of the methods so you can make an informed decision that works for you and your family. So this is really important to know, especially in the early weeks as your baby regains their birth weight. So I'd like to see a baby feed between 8 to 12 times in a 24-hour period, so 7 would be too little. In terms of when to feed your baby, it's really important to understand the hunger cues, look out for them, and always respond by feeding your baby. Examples of hunger cues could be baby becoming fidgety, putting their hands to their mouth, turning and rooting, opening their mouth as if they're rooting for the breast, and crying is definitely a late hunger cue. It means they're very hungry, potentially quite frustrated, and it might be slightly harder to get them started into the feed. If you have a very sleepy baby in the early days, then you will need to wake them for a feed to ensure you're getting enough feed in that 24-hour period. So the phrase "never wake a sleeping baby" is absolutely not true when it comes to feeding. So if a baby is latched well, the latch is nice and deep, then they will be able to transfer milk much more efficiently and get the amount they need at each feed. Efficient milk transfer also means that your breasts are being emptied at each feed, so this supports continual milk production and a good milk supply. So the best way to know that baby's getting enough milk is weight gain. So your baby may be weighed quite a lot in the early days to make sure they have regained their birth weight and continue to gain weight steadily. And in between weigh-ins, or if your baby's no longer being weighed, then nappy output is a great way to know. So if there's enough coming out, then there's enough going in. So there's a few things that you can look out for some reassurance that feeding's going well, such as weight gain, sufficient nappy output, and baby's behaviour at the breast. Are they relaxing into the feed, even if it was a bit of a faff to get them on? Are they content between feeds? And can you see and hear swallowing whilst they're feeding? And another really important aspect is how it feels for you. So even if baby might be gaining weight, if you're in a lot of pain during the feed, sore nipples, they are common, but they are not normal. They are a sign that something's wrong and a tweak needs to be made to make sure you're more comfortable during the feed. So I think if you're expecting twins or multiples, then breastfeeding is often dismissed, something that you won't even attempt because it's too hard. But my advice is never let somebody tell you what your abilities are. It's what you'd like to do. And, caring for more than one baby at a time, of course it's going to have its challenges, but it doesn't mean breastfeeding's not possible for you. If it's something you'd like to do, my biggest piece of advice is to get support. Plan the support, because I certainly think that the more babies you have, the more support you will need. So for some reason, people seem to think that they can ask a pregnant or new mum very invasive personal questions. My advice for that would be to try to drown out the noise and focus on what you want to do. And that is sometimes easier said than done. But know that as long as you are happy, your baby is happy, you're both healthy, then nothing else matters. So there's lots of places that you can find support. So I'd first start in your local community. Ask your health visitor, your GP, your community midwife, what breastfeeding support is available. Secondly, I would have a look at your local hospital. There may be an infant feeding service within that hospital. There's also local charities and national charities. There's helplines available 365 days of the year. And lastly, there are lots of private practices all across the country. So there's breastfeeding specialists like myself who will conduct home visits, which can be a much more comfortable environment for you. So I like nipple shields and believe they can actually save a breastfeeding journey. So common reasons why you might use nipple shields is if you have flat or inverted nipples, if your nipples are really sore or cracked, or if baby just isn't sustaining a latch. But shields should be a temporary solution, as they can be a hindrance if not used correctly, as baby may not be able to sustain a deep latch, and this can in turn affect baby's weight gain and your milk supply. So if you are going to use them, it's important to seek support on how to use them correctly. So solids are often introduced when baby is around 6 months old, but breast milk or formula should be baby's main source of nutrition up to 12 months. So just because solids are being introduced doesn't mean that we should stop breastfeeding necessarily. If that's something you want to do, then you would have to use formula instead up to 12 months to make sure baby's still getting all of their nutrition. So there isn't a typical feeding journey because it looks different for every single person. What's important is that you are happy with your decision, it was an informed decision, and it works for you and your family.